and welcome to The Doctor is In, your daily guide to virtual care in this time of COVID 19. I'm Dr. Freddie Gomez, and I look forward to helping you get answers to today's most pressing health issues. So, staying at home is one of the things that we're doing right now. It's GCQ. Some people are on their way to work doing the new normal, while some people are still at home following social quarantine. And part of staying at home, staying fit can be a challenge while we are in quarantine. But there are several ways to keep in top shape. In this episode, we'll talk about how you can stay physically fit at home. And we will also discuss the kinds of outdoor activities we are allowed to do while under general community quarantine. So, to talk about these activities a little bit further and explain to us the benefits of all of this, we have with us Dr. Iggy Agbayani. He's a sports medicine specialist and chairman of the Orthopedic Department at the Manila Doctors Hospital. Welcome to the show, Doc Iggy.
Hi, thank you. Thank you for inviting me.
Yes, so a lot of us may be going to work. A lot of us are also still staying at home, myself included, trying to work at home. But sometimes exercise is not the priority of a lot of people. Could you explain to us how exercise is beneficial to a person's health, how it should be part of a person's daily routine?
Well, even before the COVID-19 pandemic, exercise has always been important. But what we've discovered about COVID-19 is that it's a metabolically linked disease. So you want to improve your metabolic health. And certainly, exercise is one of the most important factors in improving metabolic health. So if someone told you you need to exercise before COVID, now with COVID you need really to exercise even more because we've discovered that people who are not exercising have cardiovascular health, have metabolic issues like diabetes, are more prone to more severe symptoms in this with this virus.
That's right. So aside from it being a metabolic issue, is the immune system going to be affected with exercise as well?
Yes, uh, exercise actually is a factor in boosting our immune system, not only because of the physical aspect, but just going outdoors, doing some kind of getting your body to get sun, even the temperature, getting your body to get a little hot, warmer than it should be, getting your muscles moving, it improves blood flow. All of these things improve our immune system. So yes, exercise is a big factor.
Now let's answer Dr. Iggy. If you could help me answer some of the social media questions that have come across. We have one question from Ivan, and he's asking how much exercise should we be getting in a day or in a week? Is there also such a thing as exercising too much?
Okay, I said that's a very general question. So you might get a general answer that might not fit you. So it's actually important to know what your activities without exercise are. And if you're not exercising, of course, you have to start from the basic minimum exercise, which is about 15 minutes 3 times a week. That's a very minimum that you should need. But of course, everyone is different. Some people are have cannot do that much exercise, and some people can even do more. So you really have to know what you can do and you can't do. And one of the key things there is to know what were your activities before. How are you doing? Do you have easy fatigability? Do you easily get lose your breath? Then of course their demand for exercise cannot be very high. Unfortunately, if I tell that to a person who's been very active, it would be a very minimal type of exercise. And exercise has to push you. Otherwise, you're not pushing your body to improve or to maintain. If your exercise is very light, probably it's not going to help much. But any exercise, of course, would have some help.
Okay, we'll answer more
The
questions,
question,
but first we have to pause for
I
a
guess, the
quick break.
question is yes about the if there's too much exercise.
Okay, yes, go ahead, doctor.
Yes, if there's too much, there is such thing as too much exercise, and of course you have to listen to your body. If, for example, if your heart rate after the day of exercise goes very high, you probably did too much exercise. If your muscles ache too much that you could hardly move, of course you did too much exercise. Exercise must always be paired with an adequate amount of recovery and rest. Otherwise, the improvement part is going to miss out. So you have to weigh that in. So you have to listen to your body to know.
Okay, thank you for that. And that's very good advice. And also to hydrate also whenever they exercise. So we have to pause for a quick break, but ahead on the program, we'll answer more questions about exercising while in quarantine and what outdoor exercises are safe to do. Don't go away. The doctor is in on CNN Philippines. We'll be right back. Welcome to The Doctor is In. I am Dr. Freddie Gomez, and we want to make the most out of your telemedicine conference today. So keep sending in your questions. So, with COVID 19 confining us to our homes, most of us are moving less while spending more time in front of the screen and binge eating. So, to address this, the World Health Organization recently released recommendations on how to stay physically fit during quarantine. So, we are still with Dr. Iggy Agbayani, who is an orthopedic surgeon. Dr. Iggy, we know that we need to keep moving to stay fit. Can you recommend a simple fitness routine at home that even beginners can do or even follow?
Uh, there shouldn't actually be just a routine for everyone. Everyone has some differences from other people where, for example, the space that they have. But I think the most basic routine that you can do are the simple calisthenics. You can do push-ups, planks, pull-ups if you can find ways. You can use a towel to put on the door and pull. But if you have the space, like if you have somewhere to go outside of your house without meeting lots of people, then of course try to use that as much as you can. But it's always a good thing to mix both strengthening and also to do some kind of aerobic exercise. Try to mix both.
All right. And before we continue with our discussion, may mga fitness activities pa rin na pwede natin gawin kahit sa labas ng bahay. CNN's Chief Medical Correspondent Dr. Sanjay Gupta shares some tips on how to make your running safe and healthy even while outdoors.
Everybody wants to be outside. I want to be outside. People are going stir crazy inside, and it's okay out here, for certain. You also want to run, and running's okay. The risk of getting the virus while you're running is really, really low, but it's not zero. So here's a couple of caveats to keep in mind. Same rules apply. You want to maintain a physical distance when you're running, just like when you're inside. We hear 6 feet. 6 feet's a bit of an arbitrary number. According to Lindsay Marr at Virginia Tech, when you run, maybe you make that closer to 10 feet or 12 feet. Why? You're breathing harder. You may be putting more virus into the air. Avoid people as much as possible. Maybe you're going to run at odd times, early morning or late at night. Maybe you're going to run different routes just to sort of mix it up. And let's say you see someone in front of you a few feet. Lindsay says maybe you switch over to the other side of the road at this point because you do want to avoid someone's, as she calls it, breath cloud. Again, some of this is arbitrary, but it's designed to keep you as safe as possible. Also, masks. The only reason you really need to wear a mask when you go out in public is if you can't physically distance. When you run, you're not going to need a mask either, as long as you keep that separation. So go ahead and do it. I do it. Dr. Fauci does it. It's good for your physical health. I think it's good for your mental health as well.
As we saw in that video, Dr. Sanjay Gupta emphasizes that masks are not required whenever we go and do physical activities like jogging or running, as long as social distancing is observed. Now, Dr. Iggy, here in Metro Manila, I see a lot of people doing their exercise routines but still having a mask on. Is there a risk of having a mask on for a lengthy period of time while doing strenuous activities such as running?
I think the CDC came out with a guideline already that if it's outdoors, the risk is very low. As long as you keep distance from other people and you don't talk with them, keep 6 feet away. You're outdoors. Don't speak loud or cough or talk. It's okay not to wear a mask if you do it outdoors.
Okay, very good. Now let's answer some of the social media questions. We have one from Franco, and he's asking, what are the right kind of foods to eat to keep ourselves healthy?
Okay. Uh, we, One of the things that was they found out what was that the effect of high insulin or actually sugars would actually be a factor in having more severe symptoms in COVID. So actually, I would recommend a low carb diet, especially in these times. Of course, vegetables are fine because they're not very high density or doesn't really peak your sugars that much. But of course, you should balance it more by eating more fish, more meat, nuts, aside from the usual. Because I think when you look at the Facebook posts, I always see people showing the cakes, the cookies, and I think we've overdid it during these quarantine times, and you should try to avoid some of them.
Okay. Doctor, I noticed a lot of people on social media are maximizing their time while in quarantine by having their own exercise regimen. But what would you recommend for those who want to lose weight but who are at the heavy side or who are obese and they are engaging their first exercise are high impact exercises, jogging, running. Are these the kind of physical activity that you would recommend for those who are on the heavy side or even obese?
I'm not too. You don't have to be very careful about it as long as you're enjoying it. It doesn't cause you joint pains. Because I wouldn't say that everyone who's obese cannot run. That's not a good advice. Every person should decide if they feel that it's more fun, then they should do it. I think some people tolerate running better. Some people don't, even if they are not obese, do not tolerate running. So I don't subscribe to that idea that if you're heavy, if you're obese, you should not do high impact exercises. I would leave it to the person to see if they feel that they can do the exercise without pain and they can enjoy it, then they should do it.
Okay, very good advice. Thank you very much, Dr. Iggy Agbayani, for joining us today and sharing your tips and insights. And just ahead, we will discuss the health benefits of biking, especially now that it's becoming a common mode of transportation during the GCQ. All that and more when the doctor is in return.
Amid the darkness, look on the bright side. In most Filipino homes, a painting or sculpture of the Last Supper hangs in the dining room. And in this all too familiar scene, Jesus, on the night before he was betrayed, broke bread with his disciples. But take a look at this painting, made by a Filipino nurse living and working in the United Arab Emirates. He depicts Jesus with our modern-day heroes, our frontliners. They are the bravest of the brave in this battle against the COVID-19 pandemic. A doctor, a nurse, a policeman, and a soldier. You also meet a chef, a food delivery staff, a restaurant server, a janitor, and a flight attendant. Instead of Jesus serving bread and wine to them, the artist has the Son of God offering only a message of thanks.
Hindi po pagkain nga po yung nakahain para sa frontliners, kundi picture po ng bata na puno na determinasyon para po palakasin yung loob ng bawat frontliners po na nakakaramdam ng pagod.
And instead of calling this painting the Last Supper, as you probably thought he would, Kim calls it a meeting. It's a meeting to talk about how to help fight the pandemic. And speaking of frontliners, a medical technologist at the Tondo Medical Center reminds so many of us that during these challenging times, we need to stop and smell the flowers. Pat Abella is a self-taught artist who loves to incorporate flora with portraits with the addition of gold leaf.
When you're sad, when you take a look at flowers, it makes you smile. When you smell them, it makes you comfortable.
Pat says flowers have a certain effect on most of us. They're a symbol of life that makes us happy, hopeful, and sometimes in love. I'm Ria Tanwatco Trillo, CNN Philippines.
Welcome to The Doctor is In. I'm Dr. Freddie Gomez. Commuting to work as part of the new normal has been challenging to say the least. And because of this, cycling has become one of the preferred modes of transportation for many Filipinos. Can cycling not only be a temporary way to get around, or can it be a healthy way of life? To help me answer that question, we have Atty. Goyo Larrazabal, cycling ambassador and co-founder of Bisikleta Pilipinas Coalition. Thank you for joining us, Atty. Goyo.
Thank you very much, Doc, for inviting me to help explain things.
Yes, bikers are definitely getting a lot of space these days, And as a biker, can you mention some of its benefits, especially in this time of GCQ?
Well, una is it gives you a really good cardio workout. If you ride for about 30 minutes to 1 hour, that's more than enough already per day, or three times a week. And most importantly, it's a non-impact sport. Just like swimming, you're not hitting the ground every time you move. Unlike running or jogging, when you're cycling, you're actually suspended, so there's no impact on your ankles and knees. So it's a very good workout, especially for those who have problems with their ankles because of age or injury.
Paano naman natin mapapanatiling ating kaligtasan na habang nagbabike? What are some of the basic safety gears that the viewers should know in case they want to try out biking? Kasama na rin kaya dito ang mga face masks as part of the normal safety gear?
Okay, the first and most important thing is you have to wear a helmet. Marami tayong makikitang siklista na walang helmet. Yung helmet, importante po yan. It prevents injuries. No? I myself had several crashes, and it's the helmet that saved my life. That's the first. The second is the gloves on both hands, no, to prevent again injuries in case you fall. Yung mask po, ako mismo I wear a surgical mask or a balaclava. I don't wear an N95 mask specifically because it limits air intake. When you're cycling, uh, you need a lot of air, and if you use an N95 mask, it limits air intake, which might cause you to faint. So me, I use a surgical mask or a balaclava. Then I put an N95 mask or a thicker mask in my backpack, and when I get to my destination, yun ay, mag-swap lang ako ng mask.
That's good. That's good advice. So aside from all the safety gear that you can incorporate, there is don't skimp on a very good quality helmet that like what you said.
Yes.
Now let's answer some social media questions. We have one from Bella. Ang tanong niya ay, since meron tayong pandemic, kailangan din bang i-sanitize ang bike? Paano po ito gagawin?
Okay. Normally kasi yung bike, I put it outside, within in the house, but outside the living room, no? Safe pa rin, but safe from the eyes of the prying thieves. If you bring it inside, normally I just have a can of Lysol and I just lightly spray on the bike. Pagkatapos, more importantly, pagpasok mo sa bahay, immediately take off your clothes, take a shower, and put the clothes you use for cycling para ilaba ka agad or you have it washed. Don't use the clothes you used outside inside your house. Especially the shoes, ha? You put it outside or at the side, pagkatapos you use a different set of clothes when you go inside the house.
Okay. We have another question from Menchu. Kailangan din ba ng social distancing tuwing nagbabike para iwasan ang COVID-19?
Okay. Normally, kung makikita natin yung mga siklista sa mga karera, races, dikit-dikit yan, di ba? They're bunched up together in a peloton because it's a race. But normally, if you commute to work or you use your bicycle to the village supermarket or the nearby grocery store or sari-sari store, you naturally have a distance between you and the other cyclists. Hindi po kayo magkatabi. Normally, there's a 1 meter distance between you and the other cyclist. What I would suggest is don't don't bike beside. If you bike beside, leave a 1 meter distance. If you bike behind the guy, leave a 2 meter distance para hindi kayo dikit, di ba? Kasi if there's a cyclist in front of you, yung air goes to the person behind. So leave a distance sideways and front and back. Wag dikit po. There has to be a little distance between cyclists.
And our last question is from Lawrence. How can we keep our lungs safe from air pollution while biking? Especially pag nasa Metro Manila, maraming traffic ang nalalanghap na usok.
Okay, what I do is I wear a surgical mask or a face mask while cycling, but a light one lang, no? Para just to keep out the pollution, but it still allows me to breathe. What I do sometimes is I rinse my nostrils when I get to the office or at home. Just light tap lang of just to flush out the dirt inside the nose. Then okay na ako. just to be sure that if there's any dirt inside, it just flushes out. Those are simple things, but it makes a big difference po.
Okay, very good, good advice. And for those who want to try out biking for the first time, please do not bike on the street right away. Practice first in a safe place
Yes,
before you do that. Before we go, Attorney Goyo,
exactly po.
do you have a short message for our viewers out there?
Okay, for those who are trying cycling now, many people suggest riding to work, using your bike to work. Get the like you said, Doc, no, get used to riding a bicycle muna, ride around the village. Ako mismo, I prefer riding on secondary roads, not the main roads like Rojas and EDSA. I take the secondary or parallel roads because it's safer. The cars run slower, less traffic, and if I need to stop, mas madali stop. Mas madali makastop. I don't counterflow because that's very dangerous. I follow all traffic rules and regulations. So, mean to say, if there's a stoplight in front, and if it's red, I stop. I don't go straight. Kasi marami pa tayong makikita yung mga siklista, they don't follow rules and regulations. They have to follow rules and regulations kasi they share the road with other vehicles po.
Very good. And good for that safety always comes first. Thank you very much, Attorney Goyo Larrazabal, for joining us today on the Doctor is In.
Thank you.
And thank you also to all the viewers for sending in your questions for each and every day. See you again tomorrow at 3:30 p.m. only here on CNN Philippines. The Doctor is In. I am Dr. Freddie Gomez. Stay safe, everyone.